us your name and where you're joining us from?
My name is Dane Wukich, and I'm from Dallas, Texas.
And what do you do out there in Dallas?
I'm the chair of orthopedic surgery at the University of Texas Southwestern Medical Center.
Excellent. And is this your first AOFAS?
It's not. I've been around a long time.
Okay, then what keeps you coming back? You're a veteran here. Why keep coming?
I think, certainly after COVID-19, we're all looking forward to having some in-person contact. So I think getting to a meeting and having, contact with people is really good. It's been some good sessions, too. I like the pre-meeting concept.
So with the pre-meeting, we did have several rounds of concurrent sessions. Tell me about some that you were able to attend, some takeaways that you found.
Sure. I attended a cable virus session this morning, which is really good because it's a complex thing, and there were some great thought leaders. And then this afternoon, I attended a session on total ankles, and that was also because that's an up-and-coming area.
And then just looking ahead to the remainder of the week, what are you looking forward to getting out of your time here?
Just taking away any tidbits. I think when you're young, you're looking for techniques. When you're old, you're looking for things to make your life simpler.
Very good. Well, thank you for your time.
Have a good day.
Can you tell us your name and where you're joining us from?
My name is Sarah Galley. I'm a foot and ankle surgeon from New Orleans, Louisiana.
Nice. Oh, my brother lives in New Orleans. That's great. So you are going to be speaking this week. Tell us the name of your session.
My name of the session is the fat flat foot and ways to treat it.
And what is that about for those who want to partake in that?
So it's a session that's about, some of the challenges that we encounter when we're trying to help the obese patient population, which is becoming an increasing burden of orthopedic surgery and really the medical community as a whole. But it's not just about the technical aspects of it, but it's really about understanding this group of patients that really require extra empathy, extra support from their physicians.
And what are attendees going to take away from that session? What are they going to walk out of that room with?
I'm hoping that they take away that they're human patients, just like the rest of our patients that we take care of. And just because their BMI may not fall into the normal ranges or even the outside of normal ranges, we still need to talk to them and understand why they're taking the time to come to see us.
And if I could ask you one more, how does it feel to be back in person again here at AOFAS? Tell me about the excitement of gathering here and seeing your peers and all that.
Very excited to be here. I trained here in Charlotte as well, so it's a little bit of a homecoming for me to see my co-fellows, the people that mentored me to where I am today. And then honestly, to just sit in a room and drink coffee and learn has felt like it's been a missing part of why I love medical education and orthopedic surgery and foot and ankle specifically. So it's good to be back.
Can you tell us your name and where you're joining us from?
I'm Andrew Wohler. I'm a fellow at Baylor Scott & White, coming from Dallas.
Excellent. From Dallas. And is this your first AOFAS?
It is not. It's actually my second one. I was able to come as a resident scholar, I think 2 years ago now.
And now you're here. How has it been so far? I know it's just the pre-meeting day.
It's been great. I think it's the first time a lot of us have been able to get back to a meeting in person in a while, and so it's really nice to kind of get to see some familiar faces and get back to good lectures.
We've been through this pandemic, just kind of being in person again, face to face. We definitely missed that interaction. Tell me about some of the education you've been able to sit in on, some things that you're taking away with you.
Well, some of the ICLs today, I was able to go to the trauma one this morning, kind of coming from a residency program where we did a decent amount of trauma here in Charlotte. It's always good to see different people talk and kind of learn how things are being done in different parts of the country. And then most recently, the kind of total ankle ICL. Obviously, there's been a lot of change and research and kind of growth that's been going on related to total ankle replacements and what we're able to do with those. And so it's really nice to kind of hear from some of the world leaders on that.
Looking ahead to the rest of this week, we have a lot still to come. What are you personally looking forward to?
A lot of it is kind of connecting with people I haven't seen in a while, number one, and then I'll have my own talk to give later this week, which is stressful enough in its own right, but really just catching up with people that I haven't seen in a while. So.
Well, I think we need to give you a little plug. Tell us about your session and what time it is, the title, what people are going to know.
Oh, it is the miscellaneous session on Saturday morning. I think it's the second to last session of the meeting, and so I'm sure it will be very well attended. but the title is it's a prospective study looking at a brace and combined therapy program for lower extremity trauma.
All right.
Yeah.
Nice. Well, thank you for your time and best of luck at the session you're speaking with, and hope you enjoy your time at the conference this week.
Thank you. I appreciate it.
Tell us your name and where you're joining us from.
John Hewitt from Greensboro, North Carolina.
Nice. And what do you do out there?
I'm an orthopedic surgeon, subspecializing in foot and ankle.
Nice. And is this your first time at AOFAS?
No, I've been a few times before.
Okay, a veteran. So what keeps you coming back?
It's a great time to see new innovations and see how the practice has evolved over time. Great way to reconnect with colleagues from the past.
And you're here for the pre-meeting day. A lot of content going on today. Tell me about some of the education you've been able to sit in on.
So in-depth sessions on everything from total ankle replacements to sports medicine injuries. Lots and lots of information.
Anything in particular that you're taking away with you?
Oh, too much stuff to count. Yeah,
That's a good thing.
Yeah, a lot of great information.
Nice. And just looking ahead to the rest of the week, is there anything you're especially looking forward to getting out here? Maybe something in the exhibit hall or a particular type of education that you're wanting to find?
I've got a list of things that I want to see in the exhibit hall, some instruments, some new technique products, a new headlamp for my glasses.
We hope you enjoy your time this week. Thank you for speaking with us.
All right, certainly, my pleasure.
Tell us your name and where you're joining us from.
David Wood. I work for Mid-Atlantic Permanente Medical Group in Baltimore.
All right, Baltimore. And is this your first time at the AOFAS?
No, this is my third time.
Third time. So what keeps you coming back?
You get to meet people that you read about, and you read their research, and you get to see all the gurus and ask them questions and bring your own cases and get their 2 cents. So
And today is the pre-meeting day, so we have a lot of content happening all day. What have you been able to partake in and enjoy?
I went to a trauma series, and then I went to a total ankle course, and then we just finished up with a total ankle lecture. That's what I went to today. Yeah.
Any good takeaways? Any thing that you think you're going to take back home with you?
Yeah, just more technique on staging and communication with colleagues. Yeah.
And if I can ask you, just looking ahead to the rest of the week, is there anything in particular that you're really looking forward to getting with your time here?
There's a lot of new technology on the market this year, so I'm looking forward to the hands-on.
So you're going to be on the exhibit hall, is that right?
Yeah, exactly.
Nice. Tell us your name, where you're joining us from, and what you do there.
All right, I'm Stephanie Gardner. I'm one of the fifth-year residents at Houston Methodist program going into foot and ankle. And that's what I'm doing here is just looking into, foot and ankle that I'm going into next year.
Very good. And this is your first time at AOFAS?
It's my second time. I was here 2 years ago, part of the resident scholar program.
So you've come back now. It's pre-meeting day, a lot of good education going on. Tell me about some courses you've been able to sit in on and what you've taken away.
Yeah. So I haven't done any today yet. I just got into town about 30 minutes ago. I also have a poster downstairs, so I went and set that up. But I'm looking forward to starting the sessions tomorrow.
Nice. What is your poster about?
So it's a case series on fifth metatarsal fractures and plating them. A lot of the times we just do screws, so it's looking into planar plating for those fractures.
Very good. Everyone, make sure you check that out. Thank you for joining us. I'll ask you one more, actually. What are you looking forward to out of the rest of your time here this week?
Just networking. I was just talking to my actual co-fellow for next year, so just kind of getting to meet more people and just learn more about topics foot and ankle.
Nice. Well, we hope you find that here. Thanks for your time.
Thank you.
Okay, can you tell us your name, where you're from, and what you do there?
Sure. My name is Zhao. I'm one of the fifth-year residents at Harvard in Boston, and really excited to be here this year for AOFAS.
Nice. We're excited to have you. Is this your first time?
So this is the first time in person. Last year I did the Resident Scholar program, but that was all virtual, and so it's nice to see everyone's faces.
It is. Tell us about just being back in person and being able to sit face-to-face and hear speakers live. What's that like?
Yeah, I think the huge aspect of it is the networking part. I'm sure people have already talked about this, but really being able to meet with the people before or after the talk and kind of putting a face to kind of everyone's expertise and discussions.
Well said. And you're here on pre-meeting day with a lot of great content, great education going on. Tell me about what you've enjoyed from the courses you've been able to sit in on.
I think it's just great to hear all these phenomenal leaders talking about their areas of expertise and really kind of gleaning their knowledge. I'm as a fifth-year resident, I'm still very early on and kind of really just trying to absorb as much as I can.
Very good. I'll ask you one more looking ahead to the remainder of this week. We have a few days left, lots of jam-packed education and everything. What are you looking forward to especially? What do you want to kind of take home with you?
I think going back to the networking, really, so talking with my co-fellow next year and also meeting some folks I'll be working with in Memphis and Campbell Clinic.
Why don't you introduce yourself to us? Tell us where you're joining us from and what you do.
My name's Dr. Jim Nunley, and I'm from Durham, North Carolina. I'm a foot and ankle surgeon at Duke University.
Excellent. And is this your first AOFAS annual meeting?
No, I've been a member since '86, and I've been a past president.
Oh, amazing. Wow. Okay, so you are not a rookie here.
That is correct. That is correct.
Tell me what keeps you coming back. What do you look forward to when you come to this event?
It's always great camaraderie, to see your friends, but more important, you get to keep great education and update yourselves.
And is there any specific content that you're looking forward to this week?
No, I think the program is broad enough that it covers all the areas of my interest, and so I'm really excited about being here.